Hello and welcome. I'm Dr. Julie Kodev. I am a board-certified chiropractic neurologist and I teach neurology for a living at the doctorate level over at Southern California University of Health Sciences. This lecture today is about nutrition, about supplements, and protecting the blood-brain barrier and the NMDA receptor. Looking at this brainwave report, we see a lot of theta waves. So note the 7.0, even a 7.5 we would consider as well. So we see a lot of theta waves here. And we can't pick one electrode or one Brodmann's area over another really when we see this overall theta of the brain here. Okay, so what are we going to do here? We can't just pick one thing, one activity, and say, okay, start doing this, and this will start to help rehabilitate your brain via the power of neuroplasticity. So when we see something like this, we have to think of the basics. And we have to go back to our basics of deflaming the brain through diet and supplements. And what is the science behind that? That's what we want to kind of look at here today. Just another couple of metrics here for you. So we could see the eyes, okay, so eyes closed, resting, okay, eyes open, focused, and we still just see theta waves throughout. So it's not just they were zoning out because their eyes were closed. Their eyes were open over here as well, so it is still theta over here as well on the right. Even during flanker, where they have to see which way the arrow is pointing, right, and acknowledge that, they're still pretty thetaed out all over the map here. So again, what do you do when you see this, right? It's not going to be, oh, this one electrode or these 5 electrodes are the culprit, right? We're going to go after that and rehab that and try and bring balance back to the brain, right? We need an overall systemic approach here. So this is some sort of concussion. This is some sort of metabolic dysfunction that is creating this situation. So thetas, what does that mean, right? So here's the brainwave table from Waxman. And we see thetas falling right here. So 4 to 7. And then we see alphas at 8 to 12. And I'm going to go ahead and call it between 7 and 8. I'm calling that a theta because it's not an alpha, right? So is it as bad as something over here? No, right? But I'm still just going to call it something that we need to rehabilitate and that it's not in the norm. And the issue with this EEG is it doesn't read under 7. So those 7s could be even lower. Okay, so it cannot pick up under 7. It's just limitations of matter of machinery. Okay, so we know that if we see a 7 and an asterisk, that's a questionable value. It could be even lower. Okay, so I go all the way up to 8, and I don't even like the 8s, right? It's not even a nice solid number of health. Okay, so all the way up to 8. Okay, is what we're gonna look at. So our thetas, okay, they could be normal over the temporal lobe. You're gonna want to look for symmetry, of course, and kind of overall health. Older people, okay, can be thetaed out. This is a young person though. Okay, so this is a young person if you look back at their birthday. And just general dysfunction. Okay, so general dysfunction. So normally seen over the temporal lobes bilaterally, particularly in older patients, but also can occur as a result of focal or generalized cerebral dysfunction. When we see it all across the board like we did with that patient, this is going to be some sort of general dysfunction. So if we're determining that this patient has some sort of systemic issue, some sort of metabolic issue, some sort of concussion, some neuroinflammation throughout the brain. So we can't pick an electrode and decide that this electrode is showing that this Brodmann's area is in need of rehab. So there's nothing specific. It's just overall generalized dysfunction. So how do we treat that, right? So again, we go to our basics: food, diet, supplements, right? But how are they gaining access to the brain? That's one of the things we want to look at here. So this picture here is how I like to describe how things gain access to the brain. So today we're going to talk about the NMDA receptor. So know that there's more receptors out there, right? But we're just going to focus in on that today and maybe hopefully gain a tiny little bit of a better understanding of it and what to do about it. So how do substances gain access? So imagine this doorway here, right? These doorways here, and we see these little guards, right, at the door, and it's going to allow substances through, right? Or it's not. So these guards need to be properly trained. There needs to be enough guards at the stations here, right? So when there's an influx of inflammation happening in the body, that these gateways here can be well protected is the idea. Okay. So today's theme, we're going to be focusing on our NMDA receptors. And this is a nice picture here, the schematic representation of the NMDA receptor complex. You could see the extracellular side right here. Okay. You could see the glutamate, okay, recognition site right here. Okay, polyamine site, and these different sites over here, okay, including glycine. And we can see this magnesium blocking site right here, okay, really important, okay, because magnesium is high on our list of substances that we want to make sure we are supplementing with in order to protect this entryway, okay, into our brains. Okay, super important to understand the structure here, structure and function going hand in hand. Okay, we can see sodium and calcium here. So let's talk a little bit about the NMDA receptor. What's its function? What is it? Well, it's involved in the long-term potentiation of action potentials. Full activation of NMDA receptors is both what we call voltage gated and ligand gated, and I'm going to show you on the next page what that means. The ion channels will only open if the postsynaptic membrane has already been depolarized and the neurotransmitters glutamate and glycine are attached. Of note here, there is a voltage-dependent magnesium block that prevents the opening of the NMDA receptor ion channels when the membrane is not depolarized. So it acts as an antagonist. This is important to remember when we are talking about taking magnesium supplements for brain health. Okay, as promised, here's your voltage-gated channel and your ligand gated channel. So a little picture here. You can see sodium, calcium, potassium, chloride here. Okay? And you can see the voltage sensor right here. Okay, so you can see the little voltage gated channels right here for you. Ligand over here, so our neurotransmitter receptors. Again, you can see calcium activated potassium channel here. You can see sodium here. You can see glutamate. This little green ball right here is glutamate. Here's your potassium here. Here's your calcium, potassium again. And cyclic nucleotide gated channel here, our sodium outside, potassium inside. And here for you. Okay, so our ligand and our voltage gated channels here. So for example, our ligand gated, okay, so ligand gated ion channels include those activated by extracellular presence of neurotransmitters such as glutamate. Okay? Other ligand channels are activated by intracellular second messengers such as calcium, okay? Or the cyclic nucleotides CAMP and CGMP. So an example of our voltage-gated channels, okay, selectively permeable to sodium, calcium, potassium, and chloride. Okay, ligand-gated ion channels include those activated by the extracellular presence of neurotransmitters. So if you needed a little reminder of what those are, that's what this is here for. Go ahead and pause that, read the whole thing if you like. The NMDA receptor belongs to the ionotropic glutamate receptor family, and it's responsible for mediating excitatory neurotransmission in the central nervous system. It's a heterotetramer made up of 2 glycine binding or GLU-N1 subunits with 8 splice variants and 2 glutamate binding GLU-N2 subunits with 4 subtypes, 2A to D, which render the receptor with different expression patterns in the brain. So we don't have to know this part here, right? That gets a little complex, but just understand that it's rendering the receptor with different expression patterns in the brain. That's important, okay? Different expression patterns in the brain. This ligand-gated ion channel is permeable to calcium, sodium, potassium, and has a voltage-gated dependent magnesium block. Now this is from Theta research. So basically it's saying something very similar, but a little more complex than the previous slide. Now, the NMDA receptor is critical for nearly every function of the brain, and it's involved in learning, memory, brain development, and synaptic plasticity. That's why we talk about it so much in neuro rehab and in trying to rehabilitate the brain via the power of neuroplasticity. NMDA receptor dysfunction has been implicated in numerous neurological disorders, including Parkinson's disease, Alzheimer's, Huntington's, schizophrenia, depression. So many things we can kind of trace back to this NMDA receptor. So it's a really good idea to understand what protects this NMDA receptor. Another interesting concept here, the in vivo characterization of NMDA modulators for analgesic tolerance. What's that mean? Okay, so drug tolerance. Look at this, it's opioids here. Okay, so think opioid epidemic. So drug overdose is a leading cause of accidental death in the United States. 60% of cases due to chronic opioid use. So analgesic tolerance refers to a decreased response to analgesic effects of opioids, requiring higher doses to achieve the desired effect. The overactivation of that NMDAR, or that NMDA receptor, has been implicated in the development of tolerance. So our effects of NMDA receptor modulators. So again, our guards at the door, okay? Guards at the door. So these NMDA receptor modulators on our blood-brain barrier in vitro model here. So changes of the functionality of the blood-brain barrier have been reported in the context of several brain-related diseases. So check this out. Okay? Multiple sclerosis, epilepsy, Alzheimer's disease, stroke. Okay? It's super important with our post-stroke rehab patients as well. Several publications indicated the presence and functionality of the NMDA receptor at the brain endothelium and a possible involvement of this NMDA receptor in the above-mentioned diseases. So that's why I picked the NMDA receptor for us to unpack and try and use clinically. Okay. Here's a list of substances. This is in no way an exhaustive list. So the more you start researching this, the more things you find act on the NMDA receptor. Okay, it's quite extensive. Okay, so here's just a handful of things that I found. So prescription medications, gabapentin, ketamine. Okay, ketamine is kind of all the rage right now for dosing with someone with ketamine in a psychiatrist or psychologist's office and working through depression. Right? Now we're starting to kind of see why, right? Because it works at that NMDA receptor. Dextromethorphan, which you might recognize that as a cough syrup ingredient. Memantine, we'll look at that as an Alzheimer's medication. Amantadine, opioids, check it out, methadone. Okay, so these opioids right here work at the NMDA receptor as well. Of course, it's going to work at the opioid receptor, right? But also an NMDA receptor. Some natural substance here. Okay, so natural substances, I always prefer, most of the time, 99% of the time, I prefer the natural substance. Let's give the body the tools that it needs to do the job that it was created to do. Okay? It doesn't need things on this left-hand side here if the body is healthy and has been given all of the tools and parts that it needs in order to be healthy. So let's make sure our zinc is where it should be. Okay, so let's make sure we have enough zinc. Magnesium, we saw that magnesium block, right? So why are we using calcium channel blockers? Synthetic calcium channel blockers. Magnesium is a calcium channel blocker. Okay, glycine, GABA, B vitamins. Okay, so that kynurenine pathway is where that's going to act, but I wanted to put that in there too to make sure that you need to be taking your methylated B vitamins. And then progesterone. There's also a synthetic available as well, which is kind of an interesting concept there, because normally, as I just told you, most of the time we prefer natural. Sometimes you got to get the levels up a little bit higher than what the liver can tolerate naturally, and so they use synthetics. So just be aware of that. I find this to be a powerhouse of a supplement. Okay, so you could see this Calm Sleep formula here. It's a powder. It effervesces in warm water. I take it every night. It's part of my basic protocol for my neuro rehab patients. It's a non-negotiable for them. Okay, so it's magnesium, GABA, theanine, and melatonin, not just for sleep, as we are learning, right? So the neuroprotective effects of it is what we're using it for. Sleep doesn't hurt either. Can't heal if you can't sleep. But even if you can sleep just fine, this is why this is still part of my protocol. I want you to understand that most people need to titrate up to 2 teaspoons. Okay, 2 teaspoons is the dose. You want to titrate up. Okay, diarrhea can be a side effect of too much magnesium too fast. So when I'm suggesting it to patients, half a teaspoon first for about 2 nights, about teaspoon for another couple nights, teaspoon and a half for a couple nights, then 2 teaspoons every night thereafter. Okay, so 2 teaspoons, titrate up so you don't get negative side effects to your patients. So one of the items on our list here that affects the NMDA receptor is going to be melatonin. And I added this paper in here for you to check it out. Melatonin attenuated or weakened, okay, attenuated the behavioral despair induced by acute neurogenic stress through the blockade of the NMDA receptor in mice. Kind of a powerful statement right there. Okay. Another powerful statement in here says it has been well documented that the administration of melatonin could reveal antidepressant-like effect in rodents. So they already know. Okay? It's been well documented is what this article is talking about. Okay? So, however, the protective effect of melatonin on stress-induced depression/anxiety and its underlying mechanism is yet to be understood. In this regard, in the current study, acute foot shock stress was used to evaluate the antidepressant-like effects of melatonin on neurogenic stress-induced depression in mice. Okay? So a lot of times when we talk about the EEG, we are talking about the numbers, right, of the P300, okay, and Tripathi's number that tells us that a P300 of 346 or above, it's really a mean average, but we're just going to call it 346 or above, indicates depression, right? And it is directly linked, if it's higher than 346, right, there's a higher grade of MDD or major depressive disorder. So these correlations here, we need to understand this. Okay? So this depression, anxiety. we can look at this and measure this with that EEG. So then what happens when we start adding melatonin into our patient's protocol? Okay, so it's about neuroinflammation, it's about depression, it's about anxiety. It's not even talking about the effect of sleep here, that they're using it for sleep. So we think of it just for sleep, okay? But it's doing so much more. Think of it as neuroprotective. Okay? Think of it as a neuro-anti-inflammatory, if you will. Neuro-antidepressant now. Okay, so our results, back to our paper here. Okay, so our results reflect the antidepressant-like effect of melatonin on neurogenic stress-induced depressive behaviors in mice. Also, our results showed that NMDA receptors could be involved in the antidepressant-like effect of melatonin. So again, giving us information about the NMDA receptor and giving us information about melatonin and its antidepressant effects. Going throughout this prep work for this lecture and learning about this, it really irked me. For a while there, I just got kind of angry, really angry actually, about the fact that there are so many known things that can help the brain with neuro rehab that are natural, like zinc and melatonin, magnesium, and progesterone and such. And it's been around for a long time. So my question to you here, my challenge to you here is, go to the site, look at the article, tell me what year it was published, and then tell me, why is this not well known by now? Okay, so go ahead and pause and go ahead and complete that mission if you just so choose. I found this to be an interesting study. So combination treatment with progesterone and vitamin D hormone is more effective than monotherapy in ischemic stroke. Okay, so the role of BDNF, TRKB, ERK1/2 signaling in neuroprotection. Okay. So what happened here? So we investigated whether combinatorial post-injury treatment with progesterone, okay, and vitamin D hormone would reduce ischemic injury more effectively than progesterone alone. In an oxygen glucose deprivation model in primary cortical neurons and in transient middle cerebral artery occlusion model in rats. Okay, so a couple of things can be inferred from this, right? So we know that progesterone is helpful in this situation. We know vitamin D is helpful in this situation. They know it. It's well documented. So then the next step here is, how do they use it in combination? Okay, so that's the idea, is that they're using it in combination. So it's already well known, well documented. Progesterone helps, vitamin D helps. Okay, so what's the combo? Okay, so interesting here. So again, P4, okay, progesterone and vitamin D each showed neuroprotection individually, but combination of what's called the best doses of those individually did not show substantial efficacy. Instead, the lower dose of vitamin D in combination with progesterone was the most effective. I found that to be interesting. I always thought it was going to be high dose progesterone, high dose vitamin D. Turns out this study is saying low dose. Okay, but no one's really questioning if either one of those therapies works, is the point here that I'm trying to make, right? So it's just well known the progesterone works for it, well known the vitamin D works for it, a lot of literature out there. Go ahead and Google PubMed, vitamin D, TBI, PubMed, progesterone, and TBI. You're going to get a lot of information, okay? Okay. Go ahead and read the rest of that if you like, and here's the citation if you like. You can read up on that. So from this article here, okay, post-ischemic stroke systemic inflammation, again, immunomodulation, immune system, okay, immunomodulation by progesterone and vitamin D hormone. So a couple highlights from this paper. Post-stroke systemic inflammation worsens behavioral deficits. Okay, so behavior. Post-stroke systemic inflammation alters peripheral immune cell populations, the immune system component. Okay. Post-stroke systemic inflammation worsens brain inflammation and apoptosis. Okay. And progesterone and vitamin D hormones synergistically exert immunomodulatory effects. We need to understand this, especially for our MS patients, because it's classified as an autoimmune disease. Here's our abstract on it. Post-stroke systemic inflammation due to injury itself and exacerbated by in-hospital infections can increase morbidity and mortality in stroke patients. In this study, we examined the immunomodulatory effects of progesterone alone and in combination with vitamin D hormone on acute phase post-stroke peripheral immune dysfunction and functional behavioral deficits. Okay, so you can read the rest of this if you like, okay, but it's talking about the immune system, it's talking about inflammation, it's talking about using progesterone and vitamin D post-stroke and the great results that they're getting. Okay, so combination treatment, okay, with progesterone and vitamin D improved outcomes better than monotherapy. Our findings can be taken to suggest that current standard of care for stroke and post-stroke infection can be substantially improved by progesterone and vitamin D combination therapy. Okay, really a big deal. Okay, immune system, behavioral, okay, neuronal inflammation, all of these things. Okay, progesterone and vitamin D, very important. Progesterone and vitamin D combo therapy modulates inflammation, response after traumatic brain injury. Again, you could keep reading these. There's so many of them though. Okay, so check this one out. At 24 hours after TBI, combination therapy shows greater efficacy in reducing neuroinflammation compared to progesterone and vitamin D given separately, and does so by modulating the TLR4 and NF-kappa B signaling pathways. Huge, okay? So let's look at this NMDA receptor. So activated or closed, okay? Activated or closed NMDA receptor. So this figure here, okay, straight up from this biologydictionary.net, just a basic resource here for us. Okay? And we're going to look at A, okay, and that's going to be over here. Okay? B, C, D, and E. Okay? So this figure depicts the NMDA receptor and a number of conformations. So right here, A, activated by glutamate and glycine. Okay, so we can see our glutamate. We can see the glutamate binding site right here. Okay. And then we can see glycine and its glycine binding site, and this is calcium channel right here. Okay. So activated NMDA receptor. Next up, we can see B and C closed due to a competitive antagonist. Okay, so closed due to a competitive antagonist. So competitive antagonist, here we see glutamate, we see a competitive antagonist, and we'll look at what that means in a little bit. The different classifications of nutrients and medications acting as an antagonist. Okay. And we see glycine antagonist here as well. So this is open, activated NMDR. This is closed. So just like those little gatekeepers, right? Remember the gatekeepers that were deciding who can get in to that castle or not on the previous slides? That's the analogy that I was making for this right here. Okay, so I'm going to erase this so you can see it again. Okay, open and closed. Okay. Gates wide open. Gatekeepers closing it down. Okay. All right, so our non-competitive antagonists right here. Okay, so let's look, D and E closed due to non-competitive or uncompetitive antagonists here. So non-competitive antagonists, uncompetitive antagonists. So this guy's right in the middle here, right? He's just blocking it. Okay. So we can see the blocking. So these are closed. These are closed. These are closed. These are closed. This is wide open. This is activated. We see our glutamate activating. Okay, we see our glycine. And then if we have an antagonist in here, closing it down. Okay, closing it down, locking up the castle at the gate. Glutamate is a very common excitatory neurotransmitter that is involved in memory formation, learning, and movement. Arousal is thought to be influenced by the excitatory neurotransmitter norepinephrine. Okay, so let's say we have a new patient walking into the office, new diagnosis of TBI or some other central nervous system issue. As we've just learned, it could be any of the neurodysfunctions, central nervous system dysfunctions, multiple sclerosis. Let's work on this with Parkinson's patients. Let's work on this with any patient that has some sort of central nervous system dysfunction. Okay, we want to make sure that the gates are open to what we want to have them open to, and have them the gates well guarded, the NMDA receptors well guarded. Okay, when times are stressful. Okay, so what do we want to do? Always want to just gather more information. Okay, get your new patient paperwork, your history of present illness. Okay, get an MRI. If they've got brain dysfunction, you need to check the structure. Okay, and then get a functional or QEEG that checks function. We've got structure, okay, and we've got function. We want to look at both. Okay. We have the capability of looking at both now. Before, we really only understood looking at structure, but it makes a whole lot of sense to look at the function now, doesn't it? Okay, we also want to look at the blood. Okay, so blood work. Look at inflammatory markers. See what's going on, right? HSCRP, high sensitivity C-reactive protein, SED rates, CWP. Look at their vitamin D, right? We saw so many articles talking about vitamin D supplementation. We want to see what we're starting off with. We do a food sensitivity test to see what they're making IgG to. Okay. You want to overhaul their diet right away. Okay. Strict anti-inflammatory, slightly keto. Okay. But super clean keto, not the bacon for breakfast and McDonald's hamburger minus the bun keto. Okay, that's not what we're doing here. No artificial anything. You want to make sure they're not ingesting monosodium glutamate. Okay, we don't want that. Okay, it's neurotoxic. Okay, we need to protect that blood-brain barrier. Okay. So what do they eat? Meats, vegetables, low glycemic fruits. You are what you eat, but you are what you eat eats as well. So the meat has to be high quality, grass-fed beefs, natural chickens, things like that. Okay, so know the source and make sure it's a high quality source. A little bit more on the blood work. Okay, so blood work should be done prior to implementing changes, and then again 30 days post starting. Okay, for certain tests of interest to monitor progress. So you'd follow up with tests that were of issue. Okay, so if they had normal hemoglobin A1C, you could run it again in 30 days. That would be fine. But if you're triaging money and insurance, fighting with insurance, you don't need to run it again. Okay, so that's the idea. So you can get this blood work from, you can order it, okay, if you're a physician. In a state that allows you to order it. Not every state allows chiropractors to order it. And some states allow acupuncturists to order it now. Okay, naturopaths should be able to order it. Obviously, medical doctors can order it. DOs can order it, and any of the like on that side of Western medicine. Sometimes there's an issue with insurance. So I put this in here so everyone can have access. Okay, so direct labs. Okay, so it's directlabs.com. You could go to this website. You could go to any buyer's group. I have no declarations of any thing to any. I'm not involved with direct labs at all. Okay, so I get no kickbacks from this. Call them here. Okay, so sometimes patients have to call and set up an account because it's easier that way. So this is the suggested blood work. Okay, I put them in order of my thoughts here of general importance. Right, if you are triaging money and you are self-pay. Okay, so I want to see a CWP. So on direct labs, you'll see exactly what that CWP is. It's a bunch of organ function tests. I want to look at a vitamin D level. Okay, so again, we want your vitamin D to be 65 to 95. Okay, it's a funny looking 9, I know. Okay, so 65 to 95 is the level that we want for our blood work. Normal blood work levels are 35 to 100, and you might be told that you have normal vitamin D, but always know your number. I want to see it between 65 and 95 for better nervous system health and better immune health. Okay, which if we're paying attention, nervous system health and immune health are the same. Okay, hemoglobin A1C. Okay, so hemoglobin A1C, you might see it as HbA1c, you might see it as HgA1c. And what this is your blood sugar average over the last 3 months or so. Okay, so how much sugar has glycosylated the hemoglobin of your red blood cells. This ANA, and we're just going to check for autoimmune dysfunction. Okay, so a basic autoimmune dysfunction here. If it's negative, it doesn't mean you don't have an autoimmune disease. But if it's positive, we're going to start looking in that direction. I want to see what your thyroid's doing. Okay, so TSH, T3, T4, and a reverse T3. TSH is not good enough. Okay, not just a TSH with reflex. Get all the numbers. And this is an HSCRP. Okay, so an HSCRP, high sensitivity C-reactive protein. If you're inflamed, it's going to be higher, right? It's most likely going to be higher. And it's really good biofeedback for you to see that number start to go down through your efforts of diet and supplements. Is it necessary? No, right? We know you're inflamed. Okay, we know you're inflamed. SUD rate, ESR, same concept. We know you're inflamed. The red blood cells are going to fall faster, right? Because they're heavier because of the inflammatory chemistry. So it's great biofeedback to let you know that what you're doing is working or it isn't, right? And then, have you been tested for Lyme? Depending on what you're working with here. So if it's a multiple sclerosis patient, test them for Lyme. Okay, if it's post-stroke rehab, probably not as important, right? It'd be good to know if it was an underlying condition, but the thought process is I wouldn't necessarily test all post-stroke patients for Lyme disease, but I'd test all my MS patients for Lyme disease. Okay, good. So my day on an ideal neuro rehab diet and regimen, you'll see some supplements on the next slides, a couple of slides. So what do I do for my patients? What do I tell my patients to do? What do I do for myself? Water with electrolytes. Okay, so I get an electrolyte powder that's clean. No artificial sugar, no artificial flavors or colors. Okay. And I get the water that I want for the day, my body weight divided by 2. Okay, body weight divided by 2. And that's how many ounces you need in a day. Okay, body weight divided by 2. So a 100-pound person needs 50 ounces of water. A 200-pound person needs 100 ounces of water as a start for the day. Put some electrolytes in there. We see on the EEGs about how we need more voltage, right? Electrolytes, electricity, okay? Conduction. Maybe some keratin drops if you've got weight to lose or you're having trouble giving up sugar and unhealthy foods. Keratin is a good way to go with that. Organic coffee. I drink that for breakfast. I'm not taking coffee away from anybody. Okay, so organic coffee or organic tea, okay, with collagen and MCT. I like the Perfect Keto.com brand, and I also like Trader Joe's has a good keto collagen brand that I like. I do a teaspoon or so of Sunfoods Golden Milk Blend. You can Google that if you want. It's turmeric and a bunch of good stuff in there. You don't have to use these brands, but use the substances that these brands have and use your favorite brand. Okay, and I put a little organic coconut milk to taste in there. Watch out for additives in coconut milk. Make sure you're getting a nice clean brand. Lunch and dinner, keto trifectas. So trifectanutrition.com, organic, paleo, keto, classic, all sorts of different ways of eating And they use grass-fed beef, they use, the healthy chickens, things like that. Do it without dairy if you can. And I use an air fryer for that. I don't like microwaves for food. Snacks throughout the day, bone broth. I use a brand called Kettle and Fire. You can make your own if you want. I personally don't cook, so that's why I like these brands. You could use another brand. You just want to watch out. Don't get anything with MSG. If it's cheap, why is it cheap? Okay, so look at the hidden ingredients. And I use the bone broth. I keep that in my cabinet like you would a medicine cabinet. Okay, so if somebody's sick or something's going on. Okay, so be ready for illness and injury. Be ready for it. Don't have to go out into the world with a traumatic brain injury. Okay, so have a plan. I like these Revolution green drinks. I do 8 ounces every hour or so if I'm on a cleanse. Okay, so organic green drinks for your patients, for yourself, for your neuro rehab. And then just sip on that bone broth, some organic tea or the golden milk throughout the day. Just keep sipping on it and getting those nutrients in, just trickling into the system. Okay. I like a hot chocolate at night with the keto collagen. Okay, so the keto collagen protein powder. Those are nice little treats if you have a little bit of a sweet tooth at night. Okay, so a couple of diet nutrition tips here. Supplements. Okay, so what supplements? So multivitamin, I take alpha base without iron, a probiotic, a nice methylated B vitamin. I like glutathione. You can get the IV drips, the shots, suppositories, nebulize. Okay, so it's hard to get actual glutathione from a pill. Okay, that's why we take things like NAC, which is down at the bottom here. You can see the NAC here, precursor for glutathione. Okay. Vitamin D. Okay, so myself, me, and my tribe, we do 50,000 IUs on Sundays. Okay, so we do it on Sundays because vitamin D is the sunshine vitamin. That's how we remember to do our big vitamin D shot for the week. It's not a shot, it's a pill. Okay, so it's one pill. I take it with a omega-3 fatty acid and a meal because you need to have a fat with it for better absorption. Okay, so vitamin D, I do a 50,000 IU and then 2,500 a day in the supplement called Orthoimmune, which is going to have NAC, C, D, zinc, and quercetin. Powerhouse of anti-inflammatories here, okay, and neuroprotection. Okay. Blood work, again, you want it 65 to 95 ASAP. I do not worry about tapering up slow. I have no idea what people are worried about with that. Okay. The risk-reward ratio is all in favor of getting vitamin D normalized into optimum level for neuro and immune system health. Okay, I'm worried more about it being low. Okay, so progesterone only pills or cream. So progesterone only, so natural version. Okay, you can get that from a physician. You can get that from anyone that can prescribe meds. You can get a progesterone-only cream from a health food store like Wild Yam, okay, and follow directions on that for the benefit of progesterone. Citrinox, okay, Citrinox, 4 capsules throughout the day as the bottle says. Okay, so Citrinox through Orthomolecular, you can check out the resources on that website from them. I am a big old fan of Viricid. I know it's for viruses, okay, but I also think it has neuroprotective components to it as well. Okay. Omega-3 fatty acids, I do the Ortho Omega, and I take it with food. Okay, so I take it with food and I take my vitamin D with it. Okay, the 2,500 Orthoimmune or the big old 50,000 IU with it because again, it is a fat and it helps with that. And then our Orthoimmune here again at the bottom, powerhouse here of NAC, C, D, zinc, and quercetin. Okay. sometimes people get worried about too much zinc with all these different combinations, so we look it up and we see what's going on. So 40 milligrams per day is the upper intake level. Okay, so health authorities set the tolerable upper intake level at 40 milligrams per day for adults. The upper limit is the highest recommended daily amount of nutrients. Okay, so for most people, this amount is unlikely to cause negative side effects. And you can click on those links there if you're worried about it. But it's hard to get that 40 milligrams. So with these supplements, just don't go over that. Okay. The issue here might be how copper is being absorbed in the body. Okay, but we know that we've made a pretty strong case for the importance with zinc. Its components to helping the brain in so many ways, and the one that really surprised me the most was Alzheimer's, and how much literature is out there about Alzheimer's and zinc. Right? So if you have Alzheimer's disease, your cells can make too much glutamate. Now remember, the NMDA receptor, glutamate. When that happens, the nerve cells get too much calcium, and that can speed up damage to them. NMDA receptor antagonists make it hard for glutamate to dock, but they still let important signals flow between. Okay, so we saw the different receptors, the antagonists, right? So this is memantine, blocks some NMDA receptors when they're too active. This is the medication they're using for Alzheimer's. Okay, so I implore you, would you prefer a medication, or would you actually rather have what your body is supposed to at that site? Okay? Would you rather have zinc available, magnesium, melatonin, all of the different natural components for healthy blood-brain barrier, for healthy NMDA receptor antagonists, and closing up that those gates? Okay? So having good guards at the gates. Instead, they're using this medication, which when you look it up, it doesn't stop Alzheimer's. Okay? Doesn't stop it. Doesn't stop the progression. Doesn't cure it. Mayo Clinic says it right there on their website. So again, nutrients for our healthy NMDA receptors. We're looking at zinc. We're looking at melatonin. We're looking at magnesium. So one of the things we want to do is ASAP get an IV drip. Okay, you're going to get hydration, which is extremely helpful for anyone, right? But especially for brain issues. So TBI patients, get this ASAP. Okay? Concussion, ASAP. As soon as you know something's going on, get an IV drip with your nutrients. Okay? If it's not right for you, they're not going to prescribe it for you. Okay? But get in there and get a consultation. Okay, so get an IV drip, hydration, especially our B vitamins, protecting that kynurine pathway, right? Magnesium, glutathione, zinc, vitamin C, powerhouses, okay, in neuroprotection. Get it in the vein right away in high doses. It's worth the price. Okay, so hopefully I've made that case that it is worth it at this point. Okay, and why they're not doing this in hospitals immediately upon entry, I don't know. One of the things we want to remember is VEGF and the nervous system. So we want to understand that VEGF promotes neurogenesis. It has trophic effects on the neurons and glia in the central nervous system and peripheral nervous system. VEGF supports neuronal migration in the developing central nervous system. VEGF is essential for neuroprotection in adults. Okay, so VEGF is essential for neuroprotection in adults. This is important. Okay, and then of course this article talks about how, there's therapeutic value in treatment of neural disorders, maybe in VEGF. Well, we already make VEGF. Okay. So the moral here of this story that I want you to make sure that you understand is that NSAIDs are known to block VEGF. Okay, NSAIDs. So the treatment with different NSAIDs significantly reduced VEGF expression regardless of the cell line studied. So cell line being, was it bone, was it nerve, was it blood vessel, was it, whatever. Didn't matter. Okay, so it's blocking it. So what do we want to remember? This is Max Living's here, so I'll give credit where credit is due. So core chiropractic care, always at the core, right? So your brain, your spinal cord, your spine, okay, needs to be aligned. We need to have good musculoskeletal health in order to have our good nervous system health. Nutrition. Mindset, okay, thoughts, traumas, toxins. Mindset is key. Mindset is extremely important. That's a different day's lecture though. Oxygen and exercise, extremely important. Again, a different day's lecture. Minimizing toxins, different lecture. But again, watch out for MSG and its hidden sources because today's theme is the NMDA receptor and glutamate antagonists here. And we want to do cranial nerve exercises. We want to do our VOR exercises and our cross crawls and all of our neuro rehab exercises and everything we know to do. But we want to not take NSAIDs. We want to manage pain in a different way, right? Because we're not going to get great neuroplasticity if we're on NSAIDs. And we want to have good nutritional supplements that I've outlined in this lecture.